In order to rein in on the spread of the COVID-19 disease, schools were among the first to be closed, and since March 2020, lower primary and nursery schools have since been kept closed. The closure of schools has no doubt affected livelihoods, but among them, children. Some of the parents have noticed changes in their young children's behavior, especially after the prolonged stay out of school.
For me, for instance, we are in an enclosed place, and because of COVID, other parents don't allow other children to come in other people's homes. So they keep to themselves. They don't mix with other children.
These changes in behavior are being linked to mental distress. 6 out of every 10 African children, Uganda inclusive, are battling with mental health challenges brought on by the prolonged closure of schools, as Dr. Amir Kabunga, a psychologist at Makerere University, explains.
COVID-19 is considered a traumatic event, and therefore it means it has affected not only the elders or the adults but also the children. Now it's prolonging and so forth and so on, and what it comes with, it has affected our children mentally.
Children in most cases cannot express themselves, but the feelings of helplessness and loneliness are visible. Dr. Kabunga reveals that children in different age groups will exhibit signs differently. Teacher Lucy Banura Mugume notes that the signs may not be visible, but the indicators of mental distress are clear.
What we call regression. Going to the behaviors, you think that they already gone through that stage. For instance, somebody was originally sucking, and he stopped it, but all of a sudden it comes back. Then that is a sign of mental problem.
If you take note, we'll become anxious, become aggressive, clingy. Even the little ones who would call toddlers, that is the ages of below 4, they also suffer mental distress.
School is not just for education, but also plays an important part in the development of a child. Shamim Nirere, the team leader at Izere Education, a social enterprise dedicated to transforming learning and skills development for young people, acknowledges the effects on the mental health of learners have been felt by those studying online and those waiting for schools to reopen.
It has affected their mental health. It has affected, we work with young people. We have parents coming to us saying, I don't know what to do for the children. They are not motivated, they are stressed, they are tired, they are annoyed, they are angry.
Martin Chiza, the Executive Director, National Children Authority, believes government has set up solutions to help deal with the challenges children may be facing during this pandemic.
One of the issues that we've done as National Children Authority is sensitizing parents, focusing on parents, reminding them of their roles and responsibilities. Government has the Uganda National Child Helpline. It's a toll-free line.
Teachers are likely to have challenges in managing classrooms due to the abuse and issues faced by children at home.
To a teacher, it wouldn't be good just to take decisions against such a pupil or a student for that matter. Get back to the child, talk to the child, and you'll discover more about it.
Fortunately, the mental challenges suffered by children during the lockdown are reversible with little deliberate effort by parents, teachers, and the community.
They are going to tell you their worries, but as they tell you their worries, don't show a state of anxiety.
I would like to advise parents to be friends with their children.
Stakeholders are now calling on all governments to prioritize and invest in children's mental health, well-being and learning as part of their response to the outbreak.
The government has tried to bring the learning resources. It has talked about bringing radios in low-income communities. The government, you see that the government is really trying its level best, but I still feel like there's room for improvement.
The government, as it thinks of opening schools, it should explain very well, explicitly, on the procedure, on when, to avoid this uncertainty. Because if we keep on having these uncertainties, our children are being affected.
Linda Ndungami, NBS, Live at 9.